Good evening, Guam. I'm Jess Lujan. Welcome to this edition of The Buzz. Very exciting show tonight. We're going to talk about healthcare with the president and chairman of the Guam Healthcare and Hospital Development Foundation, Mr. Pete Sgro. Pete, how are you doing, man?
Good, Jess. How are you?
Very good. You know, we're good buddies, and it's taken you only about 4 years to get on my show. I hope that against you. And Pete, let's just cut to the chase for this situation. The hospital, you were the founder, of course, this Healthcare and Hospital Development Foundation. You pretty much champion the building of this new hospital, regional hospital that's going out here, up here, and right down the street from us, basically.
Yes.
I was actually with you when you were talking about this, and the genesis of this basically was because of the healthcare that your mom was getting.
Yeah, and basically that was the motivating factor, Jess. You probably recall with my mom being sick for 3 months, it was really my first exposure to Wilmore Hospital. And you know, the things is, I think the main thing that we're talking about now is that was many years ago, but nothing has changed.
Yeah.
Great doctors, there's some great nurses, committed nurses, but you don't have enough equipment, you don't have enough beds, you don't have enough operating rooms. You know, when you see people that are being treated in the hallways, in the case of my mother, where you're in the hallway for a couple of days before you get into intensive care bed, you know, after her funeral, I just felt that as a community we were better than this. And I didn't know anything about hospitals. People I put together, we didn't know anything about hospitals. Decided to put a group of 22 people together, and I'm glad we never hired an off-island consultant. This was all community-based, and after 8 months, we came up with a business plan.
Now, let me talk about this hospital here, because you know there's I mean, and I don't understand. Okay, I mean, we'll talk about that a little later. But let's talk about this hospital that's going up here. The hospital beds that we have here right now. The additional hospital beds that you be adding on in the new hospital, how many additional beds would this hospital have to augment what we have right now?
Right. I think when you answer that question, Jess, you got I'll say 130 acute care beds.
Acute care, okay.
Now, that doesn't count your emergency room beds. That doesn't count your intensive care beds.
Okay.
You know, the Guam Hospital in their count, they even count the baby bassinets.
Sure.
That does not count baby bassinets. It doesn't count long-term beds. It's basically your acute care bed if you should have a heart attack or something and you're out of ICU and you're there to recover. So you're looking at 130 beds. But even with 130 beds, Guam itself is short approximately 317 beds. There's industry averages, ways you calculate this, but even taking the international standards for calculating the shortage of beds for a community, you know, we're anywhere between 200 to 317 beds.
So basically, even in the opening, you'll still be short beds.
Correct.
And some doctors are against this?
You know, it's really sad. I mean, I never in the 7 years of doing this did I ever expect that the biggest opposition would be, and I got to say this, that it's really only about 5 doctors. You know, the credit to the rest of them. I think that some of the positions that they're taking are unfortunate. We've been very transparent for 7 years. We've been open. They haven't participated, you know, and a lot of times I have to say that when you hear them speak against the hospital, you'll never hear the word patient. You'll never hear the word, you know, care for the sick. You know, it's all about what are you going to do for me today? You know, how much money am I going to make today? Or what's my clinic going to make today?
Yeah.
You know, we're all about care. We're all about patient care, increasing the standard of care. And we're going to keep moving on. We're going to keep moving on. We're going to support these investors. There's going to be a grand opening. And, you know, it's up to those 5 doctors. I mean, do they want to, you know, come in? They're welcome to come in. They have to go through an accreditation process just like anybody else. If they want to continue fighting, you know, we're not going to fight them. I mean,
well, I mean, one doctor in particular that's been pretty vocal about it is Dr. Shea, and I continuously call him out in this situation because, you know, when I look at when I look at the situation and how many patients. And this is on a daily basis. It used to be few and far between. Now on a daily basis, there's almost more wheelchair-bound patients going either to Manila or even to the mainland, and even coming back. And it's just you know, when we look at this situation, approximately how much Guam dollars, leaves island to private hospitals on an annual basis? Do you have that number?
Yeah. every year, unfortunately, I mean, your biggest export from Guam is millions of dollars to pay for oil for the Guam Power
Sure.
Authority. Your second is our healthcare dollars. Now, we're looking at every penny that originates on Guam, whether that's insurance money, whether that's your out-of-pocket
Sure,
money,
sure.
whether it's Medicare, Medicaid, that all comes from here. Guam loses $60 million, Jess.
60 million.
$60 million
60 million annually.
annually. And so when I talk to people like Dr. Shea, it makes no sense to me when I say, geez, you support sending a patient to Hawaii private hospital, you support a patient going to a private hospital in Los Angeles, a private hospital in San Francisco, a private hospital in Seattle, a hospital, but you don't support a private resident of Guam going to a private hospital in Denver? Yeah, I mean, it just doesn't make any sense to me, but, you know, Dr. Shea tries to distinguish the difference between I support the hospital, but I don't support the qualifying certificate for the hospital. And, you know, I'm a little shocked by that because he was on our foundation. And it was something that was on the original business plan. It was never anything that we kept quiet. It really took me, Jess, after the 22 people made the business plan, I literally had to fly throughout the United States because you just don't find somebody that has $250 million to invest in our island. Well, you know, every time for 20 years our island has gone out to seek investors, whether it was for hotels or anything, the government of Guam is there with their booths. They're there showing qualifying certificate programs, and they were there that time we were on a trade mission in the Philippines. These people relied on it. It's the law, and I don't understand why Dr. Shea and some people that seem to follow him don't understand that it's the law. And if they're, I'm going to have to say this, if they're upset because they didn't get one, well, it's nobody else's fault. They didn't know the law. I mean, we all have the obligation to know what the law is.
A great article today in Pacific Daily News by Dr. John Titano. and basically, here's an individual that went to the College of Guam, University of Guam, got a professional technical scholarship to go to school, to medical school, has come back, and he also talked about in building his facility, he got a qualifying certificate.
Sure.
And you're going to tell me it doesn't work? How many patients over the years, since 1985 that they were in business, how many lives have gone in there and made a difference? You know, I just can't, I can't believe, again, in healthcare, we need this. 60 million annually leaving Guam. If we can only capture even 10%, 20%, we'll talk more about that when we come back from break. Okay? Be right back.